Hi everyone, Christy Oski here from Clinical Strategies, and I'm bringing you this week's The Right Way Wednesday. This week we're going to focus a little bit on occupational therapy and medication management. So let's get started. So medication management is a hot topic for us in our industry, and it's a big tenet of our Safe Transitions program. And the reason for that is because alongside of falls, medication management or medication-related issues are a top reason for hospital readmissions. And our main goal is to allow our residents, when we discharge, whether it's to long-term care, home, assisted living, or independent living, to thrive in that space for as long as possible. So obviously preventing falls is one of those things that we do, and oftentimes medications can potentially lead to falls, which is another top issue for readmission. So we know that medication management is important. So today we're going to focus on why, and then we're going to focus on some of the documentation pieces of that from an occupational therapy standpoint. We've done a little example of a therapy necessity for medication management as it relates to occupational therapy. Patient requires skilled occupational therapy in order to increase overall strength, balance, gross motor coordination, as well as fine motor coordination as it relates to improvement of medication management. Safety during mobility and ADLs, health literacy regarding COPD exacerbations and medication changes, etc. Completion of home visit is required with a thorough assessment of medications at home. So I want to talk about a couple of tests that we should do as occupational therapists on our evaluations and throughout the plan of care. We're looking at the MedMaid Part 1 and the AMS Part 2, the top two. From a MedMaid Part 1 perspective, the portion of the screening tool is to assess the patient's knowledge of their medications, the knowledge of how to administer or take their medications, and how to physically get their medications. The AMS Part 2 tool, we are seeing this portion of the screening tool assesses the patient's ability to organize and safely administer. All things that we need our patients to do. Both of these are under the functional deficits tab of our evaluation, which I'm going to pull up here. Before we get there though, I want to address that under the IADL column there is medication management as it relates to the Health Pro scaling 1 through 7. We've added here a prior level of independent, a current level of max assist, and a long-term goal of independence. Our outcomes will pull directly from here as long as we have a prior and a current level. We don't need a goal, but it is a goal in this case because that's what we're focused on with this patient, among other things. If we scroll down on this occupational therapy evaluation, what you'll see is to the right-hand side, we've got our standardized tests, the MedMaid Part 1 and the AMS Part 2, which were both done. Prior level was no deficits, they were independent. Current level is moderate deficits, and the goal would be no deficits, of course. If we're transitioning to next level of care and the caregiver's available, we may transition with mild deficits, but in this case, we're going to shoot for no deficits as there is not a caregiver in this case at home. The other thing that we need to do is interpret the results of those standardized tests. So here's an example here. Current medication management testing via MedMaid Part 1 and AMS Part 2 indicates moderate deficits in completing medication management tasks, which based on the current scoring requires caregiver support at this time. You can also go into the fact that the caregiver support is not available, which is why we're shooting for a no deficit scoring on both of those tests and measures. This is the most important part for your reviewer to understand what those tests and measures mean to the patient at this time. So those are just some quick examples from an evaluation perspective, how you would address medication management in the therapy necessity, the functional deficit or long-term goal section, and interpreting those results. As you treat the patient as an occupational therapist, it is imperative that you are looking at the ability for them to understand changes in medication, collaborating with nursing to do so. What are the changes from previous admission or from home in the dosage? What are the side effects? Do they understand the dosage changes and the side effects? When you do your home visit, really early to mid-stay, you want to make sure you're checking their medications in the home. We've just added that to the home visit survey. Do they have over-the-counter medications? Do they have expired medications? Do they have medications that they're no longer on? That will be imperative communication in the medical record as well to the nurse who's providing care so that they can direct the education to the patient and or caregiver if there is a caregiver in the case to remove those medications and why it's important. We've seen a lot of instances where patients do go home, they have an old medication or an expired medication, and home health comes in. They continue taking that medication because it's cheaper. They don't have to pay the copay. They don't have to wait for it to be filled. There are a lot of issues with medications post-discharge from a skilled nursing facility that we need to be aware of. And if we can get that from a home visit on the front end, that would be amazing. So really trying to get into those medicine cabinets or where they keep their meds, whether it's on the counter, in a cabinet, whatever that may be, we need to ask when we're on our home visits. And like I said, we did add that to our home visit survey form. Throughout your treatment, making sure that you're focused on how they set up the habits and routines and how they set up their medications. Do they do it correctly? What happens if a problem arises during medication management? What happens if they drop a vital pill? Do we work with physical therapy and the ability to have them bend over and pick that up safely without risk of falling? Or do we educate them to take another one, to call somebody from their family or their physician's office if they've lost one? If they have a pet, how do we deal with that if it's a vital med, that if that pet caught that med? We want to look at potentially what issues could this patient have upon discharge when nobody's there with them. If there's a caregiver there, we're doing the same thing and we're educating the caregiver. If the caregiver's only there part of the time, we're educating what to do if that caregiver's not home in time to get the medications. We're looking at alternate ways to set up medications, whether it's pill boxes, time pill boxes, alerts on their cell phone. There's certain applications out there, and we're documenting all of that in our daily notes as well as our progress notes. We don't take enough credit for what we do in our progress notes related to education and medication management. So all of this trial and error education, and do not forget about the teach back method. So as you teach your patient or caregiver something, make sure that they have the ability to teach it back to you as if they're your patient, or as if you're their patient. So that there's no misinterpretation of what they're trying to learn at that time. So discharge summary, same thing. You're going to summarize all of the education and training that you've done, all the trials that you've done, making sure that you've put your home visit and what your recommendations were, the collaboration with nursing through medication management, to kind of summarize everything that you've done. So that's a lot of information today on medication management, quick, down and dirty for occupational therapy. I could probably talk about this for days. So I hope you enjoyed it. I hope you learned something. Have a great week.